Welcome, everybody, to our 76th episode, Energy Medicine, a New Frontier in Healing, the many causes of pain and natural cures. Very interesting topic for you tonight. Before we get started, little housekeeping. For those of you that have pets and you're going to take them to the vet for some diagnostics, some blood workup, better make sure your pet has a Medicare card or insurance. My lady friend took her cat into the vet for evaluation, and she got a $4,000 bill for diagnostics. So be careful before you get involved. Try to get an estimate on the costs on that one. On another note, we're going to be taking our summer vacation in August and the first 2 weeks of September. So things will be off the air just to recharge my batteries, and people are going to be on vacation anyway. So the next two meetings, and then we'll be off until second week in September. So we got plenty of catch up if you want on GHS.live. We have the 10-part Cancer Deconstructed series, which is very, very powerful, and a lot of information to digest it. Each episode's about 30 to 45 minutes, and it'll open up your eyes and your mind to the reality of cancer. So you can share with your friends, try to wake them up. And anyway, got a great show for you tonight. Some of the topics: learn the many potential common causes for acute and chronic pain, understanding the physiology of pain, learn the many causes of chronic headaches, learn some uncommon causes for headaches and pain, and some specific natural cures and frequency, both and nutritional, to resolve pain. So as old Nikola Tesla once said, if you want to find the secrets of the universe, think in terms of energy, frequency, and vibration. Chronic pain affects at least 10% of the world population, approximately 60 million people, with estimates of chronic pain prevalence closer to 20 to 25% in some countries and regions. An additional 1 in 10 people develop chronic pain every year worldwide. Okay. Interestingly, the most disadvantaged portion of the population bears the higher burden of persistent pain and lesser likelihood of effective treatment. Okay. The many potential common causes for acute and chronic pain. Intestinal toxemia. This represents one major cause for low back and sciatic pain. A study done by a Dr. R.B. Osgood, MD, showed that elimination of the toxemia totally resolved the lower back and sciatic pain in a group of patients. When the toxemia returned because of poor diet, the low back and sciatic pain also returned. Intestinal toxemia is the basis for many clinical symptoms, including fatigue, nervousness, gastrointestinal conditions, skin manifestations, especially acne, rosacea, endocrine disturbances, neurocirculatory abnormalities, and headaches. If you do not have 3 bowel movements a day, you're constipated. If your stools have an odoriferous smell, you have putrefaction accompanied by toxic chemicals. And some of these toxic chemicals are phenol, which is very, very caustic. Results from the breakdown of tyrosine, which is an amino acid. Skatol and indole, breakdown of tryptophan. That's what's in turkey, tryptophan, and milk. It causes depression of the circulation and the central nervous system and responsible for your foul breath. High protein diets are primarily responsible for high levels of skatol, indole, phenol, hydrogen sulfide, putrescine, and cadaverine, and they result from the breakdown of tryptophan. Histamine is breakdown of tryptophan also, and tyramine which is the breakdown of tyrosine, similar in structure to epinephrine, and can raise your blood pressure. Also, nerve entrapment from spastic muscles can cause chronic and acute pain. Spastic muscles can be caused by magnesium deficiency, B complex deficiency, hypothyroidism or underactive thyroid, hypoglycemia, low blood sugar, deficiency of essential fatty acids, the omega-6s, low potassium, decrease in microcirculation, hypoxia or low oxygen, and chronic inflammation. Spinal subluxations or fixations. Subluxations is when like one vertebrae pops out of alignment. Fixations is when the vertebrae on the top and the bottom of the area lock up and there's no motion. So it's misalignment of vertebrae can cause compression and pulling on nerve roots. Bulged and herniated discs, direct pressure on the nerves. TMJ dysfunction, temporomandibular joint dysfunction. 6 of the 12 cranial nerves pass by your TM joint, plus the lower jaw only has 136 muscles attached to it. So if you have a malocclusion or your maxilla is distorted, your lower jaw is out of alignment, you're going to directly affect 136 muscles. Viruses, shingles, herpes, simplex 1 and 2, Epstein-Barr virus, cytomegalovirus, retroviruses. They get into the nerves in the brain and the organs and represent a major source for pain. The toxins that they produce and the chemicals they pump out irritate the hell out of the nerves. Chemicals such as glyphosate, it's an herbicide, dioxin, PCBs, and xenobiotics. They get into organs, tissues, and nerves and cause chronic inflammation and irritation of the nerves. Your heavy metals, the most common ones I find clinically that cause problems in patients are mercury, cadmium, arsenic, aluminum, lead, and nickel. A lot of women's jewelry that is silver has nickel in it as a hardening agent. It's not only carcinogenic, but it can cause rashes anywhere in the body and chronic inflammation. Gets into the tissues. The worst acupuncture piercing is the belly button. If you want intestinal problems, menstrual problems, infertility, go for it. Lyme and co-infections, especially in the joints, you'll find Lyme where there's a lot of blood circulation and inflammation. The co-infections are Bartonella, Babesia, Mycoplasma pneumoniae, Rickettsia, Rocky Mountain spotted fever. These are all potential co-infection factors with Lyme. Invariably, it's not just the spirochetes of the Lyme that are causing the problem, it's the co-infections that are causing the irritations. Tyramine, amino acid. Tyramine is a substance found naturally in some foods. It's especially found in aged and fermented foods, such as aged cheeses, smoked fish, cured meats, and some types of beer. One explanation is that it causes nerve cells in your brain to release the chemical norepinephrine, which is a catecholamine that causes vasoconstriction. Chlamydia trachomatis, sexually transmitted infection, most common infection causing blindness, and the most common sexually transmitted bacterium. And it's present in a lot of joints. So understanding the physiology of pain. So trauma releases cytokines, which causes inflammation and irritation to the nerves, tissue, organs, and responsible for tissue injury and activation of the sensory neurons in your spinal cord and elsewhere in the nervous system. Low acid pH, the SAD diet, standard American diet, sets you up for causing acid condition in your body. Most people are down around 6.5 on their pH, which then lowers the cell membrane potential, which prevents toxins, metabolic wastes, viruses from getting out, and prevents oxygen and nutrients from entering the cell. The end result, pain. Hypothyroidism. A decrease in the cell metabolism causes a buildup of metabolic waste, which trigger off diffuse pain patterns, and it represents one of the major causes for fibromyalgia, which is generalized diffuse pain patterns. Toxicity from the intestines in the form of putrefaction will elicit pain. There's also a direct connection from the colon to the brain via the vagus nerve and your lymphatic system, and one major reason for headaches and also dementia. Nutritional deficiency of organic cold-pressed omega-6 oils, which are anti-inflammatory. Now, unfortunately, most of the studies that were done with the omega-6 oils represent adulterated omega-6 oils, which are pro-inflammatory. And this is why a lot of your physicians poo-poo omega-6 oils, because they're not aware of the fact that the so-called scientific studies were done with adulterated omega-6 oils, sunflower, safflower, avocado oil, walnut oil, so forth. These oils are essential for the production of prostaglandins 1s and 3s, both of which are anti-inflammatory and anti-pain. About a year ago, I had a patient, he had pain in every joint of his body, arthritic pains. He was taking, I think, Motrin, and 10 days after I put him on the organic cold-pressed omega-6 oils, 90% of his joint pains totally disappeared. So, unfortunately, most people do not get the organic and cold-pressed omega-6 oils. Interestingly, the skin has a 1,000-to-1 ratio of omega-6 to omega-3 oils. Your nervous system and your brain has a 100-to-1 ratio of omega-6 to omega-3 oils. Your organs have a 4-to-1 ratio of omega-6 to omega-3, and your adipose tissue, I think, is 22.5-to-1 of 6-to-3. So how in the world can omega-3 be more important than omega-6? Also, studies done show that if you have severe deficiencies of omega-6 oils, you are in deep, deep trouble. The body can handle deficiencies of omega-3 oils, but not omega-6. So remember that. Unfortunately, the doctors think omega-3 and that you need fish oil is the panacea for a lot of heart problems and other issues. Don't believe it. Heavy metals disrupt the physiology of the cells with the end result of a buildup of toxins. And interestingly, mercury will destroy the tubulin that surrounds the nerve fibers, causing intractable pain. Mercury also gives off between 13 and 21 different frequencies, and that's why it's the second most toxic metal on this planet. It disrupts the physiology of the cell function. Your big complex vitamins, thiamine, B1, acts as an antioxidant. Pyroxidine, which is B6, balances your nerve metabolism. B12 maintains the myelin sheaths of your nerves, which is like the insulation wire on your telephone cables. The presence of the Bs, the B1, the B6, the B12, supports the regeneration of new cell structures. Vitamin B1 facilitates the usage of carbohydrates for energy production. B1 facilitates the usage of the carbohydrate, whereas B12 promotes nerve cell survival and remyelinization. Absence of these vitamins will favor permanent nerve damage and pain, eventually leading to peripheral neuropathy. Now, when you see pastas and breads that are fortified with B vitamins, they're synthetic garbage. That's going to cause infertility and low sperm counts. It's already been documented. Enzymes are proteins that perform the everyday work within a cell. This includes increasing the efficiency of chemical reactions, making energy molecules called ATP, adenosine triphosphate, moving compounds or components of the cell and other substances, breaking down molecules, which is called catabolism, and building new molecules called anabolism. So cooking foods destroys enzymes, and usually in the first 20 seconds. Ribosomes, they're little organelles that create proteins. The cells use the proteins to perform important functions such as repairing cellular damage and directing chemical processes. A single cell may contain up to as many 10 million ribosomes. Within these ribosomes, cells could not be able to produce protein and would not be able to function properly. Damaged cell structures are a critical part, causing pain and dysfunction. Without ribosomes to produce proteins, life as we know it would not be possible. Some uncommon causes for headaches and pain. Cranial distortions. There are many potential causes for cranial distortions: traumas to the head, dental bridge work, orthodontic braces, including Invisalign treatment, forceful tooth extraction, rough chiropractic or osteopathic adjustments, forceps delivery of the baby, premature loss of posterior teeth. Sutural jamming. Sutures are your expansion contraction joints between the skull bones. They can become jammed, causing direct pain and also headaches. Prescription drugs. They can become trapped in the different organs. As an example, a patient who had taken an anti-nausea pain during pregnancy called Bendictin, she developed systemic lupus. Symptoms associated with lupus are arthritic pain, headaches, muscle pain, stomach pain, fatigue, and many other symptoms. The drug in her particular case was trapped in her liver. It took 9 months to chelate out the drug using a homeopathic made from the actual drug. Interestingly, the patient's lupus totally disappeared. Also of interest, the fetus, which was her daughter, had the drug trapped in her right kidney. So from like age 5 to age 42, she had right kidney problems. And 6 weeks after I put her on the homeopathic to pull the Bendictin out of her body, her kidney problems totally cleared up. Cavitations. Unfortunately, there are a lot of brain dead dentists out there who don't believe that cavitations actually exist. They'll defend to the death that what they're saying is right, but they're full of BS, unfortunately. There are infections in the jaw bones that usually result from extraction of teeth. Root canal treated teeth. It's a dead organ, creates chronic inflammation, which attracts pathogens. And if you extract a tooth and you don't get rid of the infection, you're going to get a residual infection in the jawbone. Years ago, I had a patient who had emphysema. The physician had him on steroids, and I tracked it down to a strep infection in the jawbone where he had a bicuspid tooth extracted 15 years before the incidence of his lung problem. When I cleared up the infection in the jawbone, his emphysema totally disappeared. So those dentists who don't believe in cavitations, they're living in la la land. Toxic dental materials. Dental resins have bisphenol A, which is synthetic estrogen, which could be very disturbing. Bisphenol A can cause hormone imbalances. Really a problem. You really should get street smart and ask your dentist when you're going to get a cavity filled, can he test the biocompatibility of the materials he's putting in? Because if he doesn't, it can create chronic inflammation in your body and really upset the apple cart. I've seen pictures of patients with severe lesions all over their body from toluene and chemical bases that were put in under the white fillings. So word to the wise, you got to interview your dentist because these guys, most of them are brain dead, honest to God. They're what I call dental terrorists. So the bottom line is you can get galvanic currents that result from dissimilar metals in the mouth. You can have a mercury filling next to a gold crown causing chronic pain in the tooth, causing chronic periodontitis or gingival inflammation and bleeding. You can have problems with EMFs, electromagnetic frequencies, cell phone towers, cell phones, electronic systems, smoke detectors, Wi-Fi, TATRA emergency systems, clock radios, LED bulbs, and computers provide the sources for EMFs. and they cause systemic inflammation in the body. There's a fantastic book called Brain Allergies, written by William Philpott, MD, and Dwight Kalita, PhD. It's on Amazon. If you want to learn more about brain allergies, you can have an allergy to chicken or dairy or anything, beef, and cause headaches and all kinds of pains. Gallbladder problem. This organ stores the bile, which contains the fat emulsifiers, as well as the toxins that the liver pulls out of the bloodstream and stores. When you eat, your gallbladder squeezes down, the bile goes into your intestines and out with the feces. So these toxins and the inability to break down the fat can be a source of migraines. So circulating fat in your blood can decrease the amount of oxygen available to your brain, tissues, and organs. Years ago, I had an 18-year-old high school student who had severe headaches, and I tracked it down to a gallbladder problem because the food that they were giving him at his live-away high school was loaded with fat. Once we got his gallbladder straightened out, put him on digestive enzymes like lipase and choline and AF beta food, his gallbladder headaches totally disappeared. Other organs can reflex pain signals to the brain and dump toxins that will affect the brain. You can also have scars, surgical scars or scars from trauma, reflexing pain. I had a woman who had pain in her little toe for 25 years, and it resulted from a gallbladder surgery. When I treated the scar from the gallbladder, the pain in her little toe totally disappeared. So some people overlook these things. Most doctors don't even factor these into the pain equation because they're ignorant. Torqued pelvis. So when the pelvis becomes rotated, it creates tension in the dural membrane, which can directly affect the upper cervical vertebrae and your intracranial dural membranes. When these membranes become twisted, they can elicit pain from the sensory nerves that innervate the structure and cause chronic and acute pain. Mercury fillings. This heavy metal is the second most toxic substance on the planet. The mercury attaches to your red blood cells, preventing oxygen from attaching, which in turn can result in headaches and generalized pain because of lack of oxygen. Pronated foot or feet can torque or twist your dural membrane, causing pain along your spine and your head. Most doctors and chiropractors, unfortunately, don't check for pronated feet, but it's all attached to the body, and you can have hoof and mouth disease as a result. Only kidding. It's something that must be taken into the equation. Specific natural cures. We're talking like frequencies and nutritional to resolve pain. You can alkalize the body. So greens like kale, collard greens, celery, cilantro, bok choy, they contain minerals which help alkalize the body. The more acidic one becomes, the lower their pain threshold is. So a little splinter can feel like someone has an ice pick stuck in you. The more acidic you are, the lower your pain threshold. Normal pain threshold should be like 7.35 to 7.45. Most people around 6.5, which is not good. Sets you up for chronic degenerative diseases. Food-based B complexes. If your B vitamins smell like a drug, they're synthetic. If they give you a stomach ache or distress in your stomach, invariably they're synthetic. Food-based B vitamins will not cause those type of reactions. Unfiltered water, okay, really toxic. So you really want to filter your water. In my house, I filter it literally 3 times before I drink it, and my water tastes sweet. So preferably water is filtered by several systems because if you don't filter your water, your organs will. They're going to sludge up and hasten degenerative diseases, people. It's an insurance policy that you use every day. It's not the hocus pocus. Spanish black radish by Standard Process Labs. The supplement is high in sulforaphane, which accelerates the detoxification and excretion of potentially toxic substances. Very, very efficient way. I spoke to a chiropractor years ago who treated a patient who had colon cancer with Spanish black radish only and got rid of the colon cancer. Again, remove the splinters or initiator, and the cancer cells go back to factory default. Digestive enzymes. It enhances the breakdown of products of the food which we eat. Many of the enzymes in our food are destroyed from cooking in the first 20 seconds. It also helps break down the nutrients in our food so that they don't provide toxic waste in your intestines. Resveratrol, very powerful antioxidant. It protects the brain, increases insulin sensitivity. It's anti-inflammatory to assist in joint pain. It suppresses cancer cells present in red wines and Japanese knotweed. Curcumin, another very powerful antioxidant and anti-inflammatory. Again, assists the liver in processing cytokines, other toxins that the liver pulls out of the blood, and which also, causes the pain and the inflammation. Glutathione, it's a tripeptide amino acid. It's a powerful antioxidant and anti-inflammatory. Again, assists the liver in processing cytokines and other toxins that cause pain and inflammation. Zymesins, probably one of the best systemic enzymes on the planet. 5 primary actions of zymesins. It's a proteolytic enzymes. Number 1, it's anti-inflammatory. Number 2, it dissolves fibrosis, scar tissue. A lot of my patients that have taken it for a 9-month period tell me that their post-surgical scars from years ago are disappearing. It cleanses the blood of foreign protein. It's adaptogenic, meaning it modulates the body. So if something's over-functioning, it tones it down. If it's under-functioning, it brings it up. It's also bactericidal and mildly antiviral. So some specific frequencies for pain resolution. 1 hertz will calm you down like a newborn baby. 7 hertz, 70 hertz, 85 hertz, very effective for acute pain. 76 hertz for chronic pain. 90 hertz, if you do a sweep from 90 hertz to 111 hertz, it's an endorphin release, which is more powerful than any opioid that the pharmaceutical company can produce. And 174 hertz is good for pain relief. Now, color therapy is also effective in pain relief. In fact, many years ago, when I used to go down to the SOT chiropractic meetings in Omaha, Major DeJarnay tried to explain to the audience one during the lecture period that he applied for a patent to use color filters for pain relief, and of course they wouldn't give it to him because it would hamper the revenue stream from the NSAID drugs that are very popular. So indigo is for pain. That's 425 to 450 nanometers. Green is good for balancing. It's 495 to 570 nanometers. Turquoise is good for acute pain. That's 490 times 10 to the positive 9 power. Lemon for chronic pain, 530 to 510 terahertz. Lemon or orange color for paralysis, and magenta is good for emotional upheaval. So that concludes my part of the presentation. And now we'll get into the live streaming for questions from our audience. What do you see if someone has TMJ and also viruses, etc., that can get to the brain? Absolutely, they can get to the brain. So the key is usually TMJ is multifactorial. You can use quantum testing, determine the viruses that may be present in the TM joint. You can have cytomegalovirus, Epstein-Barr virus, herpes simplex 1 and 2. You also want to make sure that the thyroid is functioning properly, because with a low thyroid, your body cannot resolve infections, and they can migrate from the nerves up into the brain. So from my perspective, I usually find co-infections along with the TMJ and a lot of underactive thyroids associated with it. Good question, Stephanie. Carlina, what is the best potassium to take? I like potassium orotate. Hans Nieper, the very well-noted German physician, put together formulas of orotates, magnesium, potassium, and calcium orotate, because that's the form that these minerals appear in mother's milk. So why try to reinvent the wheel? You figure mother's milk has got to be the most perfect food for the newborn baby. So why not go with it? So potassium orotate. Also, potassium is present in the leaves of celery. So eat the leaves of celery, you get potassium. You eat the stalks, you get sodium. So Mother Nature has balance. Golda S., please indicate how to contact you by email or phone. My email, ghsdoc11@gmail.com. The office phone number is 800-272-2323. So those two ways can get to me. How to protect inside and outside from the horrific 4 and 5G radiation. Who is the maker of the divine rods and where do you can buy them? Okay, I personally walk around. Oh, I had my Tesla energy card. I think I left it upstairs. Took it out of my pocket earlier. But anyway, the Tesla energy card is very here. It's basically has a magnetic strip on the back, and I have scalar energy and 18 healing frequencies in it. When I put it in my pocket, it protects me against the 4G, 5G radiation. As far as the maker of the divine rods, Paul Moon up in Toronto, Canada, makes them. I just sold my last pair today to a patient from Colorado, but I can order some more. If you're interested, I can order probably another 6 or so and get them in probably in about a week or so. So they are $150. They're very well constructed. They follow the divine dimensions of 12 inches for the stem and 5 inches for the handle. And they work incredibly well. Better than muscle testing. Let's see, next question. Jennifer C., my daughter found out with her long haul COVID, she has chronic Lyme. Have you seen Lyme cause bacteria like acne? Yeah, absolutely. Over the cheeks and chin and upper neck. Absolutely. Any of these infections that disrupt the microbiome in the intestine. So like anything else, you always want to clean out your intestine, get a good probiotic in the intestines, make sure that the thyroid is working properly, because if you have chronic infections and they're not responding to treatment, invariably you have an underactive thyroid. And if you don't support the thyroid and get that working by cleaning out the splinters or initiators, you're not going to hit a home run. So, Facebook user, what are the good oils? Avocado oil is good. Again, cold pressed, organic. Safflower oil, organic cold pressed, sunflower oil, evening primrose oil, extra virgin coconut oil. It has a real good vitamin E content in there. It literally can stay on the countertop for probably 5 years and not go rancid because it's high in vitamin E. So there are the oils. I use Clinician's Preference. It's a formula that Brian S. Peskin put together. It's an 11-to-1 ratio of omega-6 to omega-3. Use it with pretty much all my patients that test positive for it, and especially with all cancer patients. So go for it. Okay. How do you repeated detox from heavy metals in nanoparticle forms as we are sprayed from the sun dimming or project chemtrails and that kind of nonsense. Well, again, the liver is your main filter. So before you start pulling heavy metals out, you must clean the liver out. Glutathione, curcumin, superoxide dismutase, SOD, the B vitamins, vitamin C, they're all very important for the liver. Basically, you also want to make sure that you're in the alkaline range, because if you're deficient in trace minerals, the body will not let go of the heavy metals. So liver cleanse, make sure that the trace minerals are up there. You're more in the alkaline pH, 735 to 745. And then I use Platinum Plus, which is a very good amino acid that pulls it out. Also, a zeolite, a good quality zeolite, can pull heavy metals out. Cilantro, you literally will pull heavy metals out of the brain. Touchstone Essentials has an extra strength zeolite that has the zeolite molecule encapsulated with water molecules, so it literally gets through the blood-brain barrier into your brain. So that's how I would get after the nanoparticles: glutathione, curcumin, Platinum Plus. Prepare the liver, get the body alkalized, and then you'll have a much more successful result. Dennis, good to hear from you. Is there a natural method to decrease cysts in the body? Sinus cysts, cysts on the liver, ovarian, that could cause referred pain. Well, cysts are usually the body's way of walling off a toxin. So what's in the cyst? Is it cytomegalovirus? Is it parasites? Is it a heavy metal? Is it glyphosate? So from my perspective, what's the splinter or initiator, and disrupt it. Also, the cell membranes you want to repair with the omega-6 oils so that the toxins can get out from the inside of the cyst. Also, I'd have to look in the Rife book, but I would imagine that they have frequencies for cysts. But again, prepare the body. You want to get the liver cleaned out, make sure your thyroid is working to protect from the toxins. Rife frequencies are very good. Ozone. Interestingly, you can have plastic membranes in the body from adulterated oils, and the ozone will perfuse through the plastic membrane. So ozone would be a very effective way of penetrating cysts and tumors and any other body's defenses to get after the cysts. So great question. Thank you. Is the video you did 2 weeks ago where we had to go on Zoom? Yes, that was recorded. GHSDOC.live. GHSDOC.live. I have all my videos archived there. And tonight's video will be there also. Do you recommend dental implants? No, with titanium. No way, Jose. Titanium acts as an antenna, pulling EMFs into the body, creating inflammation. Plus, from the studies that I've seen in the dental literature, you can get titanium oxide formed at the interface between the bone and the implant. I would rather go for zirconia. I think it's a whole lot safer. How can I have divine rods? I will order them tomorrow from Dr. Moon, and you can contact our office at 800-272-2323 and get your name on the list so we can mail them out to you when we get them. You have a Therapi device, correct? Yes, I do. Do you use it often? Every day, Stephanie. Every day. I just had a woman in from Colorado for 3 days, and she's very much into energy healing, and she had an incredible experience with 3 sessions of the Therapi. I treat myself 3 times a week when I'm at the office with the Therapi. It's very powerful. The scalar energy and the 18 healing frequencies basically help repair the DNA, neutralize the frequencies of toxic substances, and stimulate stem cells for repair. So it's very, very effective. And back in the 60s, Anton Priori in France was curing almost 100% of all kinds of cancer with scalar energy. So yes, it's very, very invaluable. And like I said, we use it every day with patients. How long each session? I literally test each patient. I test 3, 6, 9, 12, 18 minutes. And it's what the body wants. I just don't use a standard protocol for everybody. I use the divining rods literally to test the patient. And that's how I determine what they need. And it calms people down, and it's wonderful for healing. So. Well, Jennifer, thank you. It's my fun digging up this information and putting it together for everybody. Nice glasses. These are my hyperpolarized lenses, people. Hyperpolarized lenses these are produced by Zepter over in Switzerland, $5 billion a year company, very proactive. And they're blue blockers, but they also increase the microcirculation by 48%. One little story I'd like to share with you, my little Tesla energy card, I literally can imprint scalar energy into this thing, just like the Therapi. And a good friend of mine, he's a retired integrated medical doctor down in Naples, Florida, gave one of my cards to one of his neighbors that live in this community, gated community. And the poor guy had a macular degeneration, legally blind. And after 3 days, he told my friend, he says, I could see better. So he's treating himself with the Tesla energy card, with the scalar energy. And in about 2 weeks, he's going back for some major testing of his retina. It'll be interesting to see what the ophthalmologist's impression is as a result of the frequencies. It'd be pretty darn amazing if they can have documented objective proof that their healing has taken place on his retina and the other eye structures. I think there will be, to be honest with you, but we'll wait and see for the ophthalmologist to give the final decision on that one. But I'm excited with these things. My philosophy more and more is that you put healing frequencies into your aura, and that's why, I literally keep my jade donuts in my pocket, if I can find it. I have one in each pocket, somewhere it's stuck in here. I have one donut in each pocket and one around my neck, and it enhances my aura, supercharges it. And my energy is like super high, and it also helps keep me healthy. So that's what it's all about. And the fact that it's in a donut shaped circular, the energy just keeps going around and around and doesn't dissipate from the jade donut structure. So one big advantage of the donut. So if we have No more questions? Oh, the donuts. Basically, we sell them through our office, but we custom imprint each donut with a frequency that's compatible with your body. So I literally can use the divining rods and diagnose off a digital picture that you can email us and determine what frequencies are best for you. And again, I don't like to shotgun with standard protocol. I'd like to put out frequencies that are compatible with your energy pattern to enhance your healing. So that's how we do it. You ever heard of a mission coil out of Russia? No. They're probably all takeoffs on the Tesla coil. But any type of coil is going to pull ambient energy out of the environment and concentrate it. But yeah, there's so many offshoots of Tesla's technology, but everyone throws their own little name on it. But I think ultimately they're a takeoff on the Tesla coil. So anyway, thank you so much for taking time out of your busy schedule. And next week, we'll be looking forward to presenting some wonderful information. So God bless and see you next week. Stay healthy.